So desensitization refers to the process of bringing patients' antibody levels down. And this is relevant for all organ transplantation, but specifically for the heart transplant program and the heart failure program, these are patients who need a heart transplant, but may not be eligible for one because of their high antibody levels. So we use a series of drugs and therapies to bring their antibody levels down and provide them with an opportunity to then be eligible for transplantation afterwards. Anytime we work up a patient who has heart failure, we do an antibody screen, and we work with the immunogenetics lab to assess patients' antibody levels. Patients who have high antibody levels, and we learn that there's a low likelihood that we would be able to find a donor heart that doesn't cross the antibodies that are specific for the recipient, are then considered for desensitization if we feel that we can't get them a heart transplant by just aggressive donor techniques alone. The ideal candidate for a desensitization program is somebody who we can evaluate in our clinic. These are patients that need therapy for a period of time, usually about 3 months. So we like to have these patients be able to come into our clinic to give us time to be able to desensitize them and work with them to assess their antibody levels serially over time. That being said, we can and we have considered sick patients who are in the hospital, and we desensitize them while they're in the hospital with us. So most of the time, these medications are given at an infusion center. And so we work with the referring providers to discuss what the medication regimen will be, what the follow-up will be in terms of labs, what things to look for in terms of acuity of illness. We're able to take this on ourselves, but we're also willing to work with referring providers to work together on this. Patients who don't live locally, we can work with the referring provider for them to get desensitized at where they are locally. So we work with the patients really closely. Before we start the actual desensitization aspect of the program, we ask that patients get the appropriate vaccines because they will be at higher risk for infection while they're being desensitized and afterwards. And during the desensitization process, which are drugs that are administered initially weekly and then biweekly and then further on from there, we test antibody levels on a biweekly basis. So we work with the patients and we'll talk with the patients about how their antibody levels are coming down. And when they reach a window for transplant, then we list those patients for transplant and move forward from there. Generally, our desensitization program starts with a 2-month period of time. And the window in which a patient becomes eligible for transplant is once we think that there is a reasonable chance that there would be a donor heart available based off their antibody levels. We have several factors that I think are unique to our program. The first is the patients that we're willing to consider for this program. We have performed multi-organ transplantation in these patients. Second is the actual regimen itself. Of the limited programs that do have desensitization programs are inpatient programs. Our approach is starting with this outpatient regimen in infusion centers. Our regimen starts with a 2-drug regimen and then adds on a 3rd drug. And the approach and specific medications we use are, we believe, synergistic with each other and actually have not been used altogether in a desensitization program of any organ, but in particular in cardiac transplantation anywhere else that I'm familiar with in the United States. Our approach in the cardiac space is not to just try to bring the antibody levels down for a period of time to provide a window for transplant, but slowly bring their antibody levels down in a way where we not only target what we see, which are the circulating antibodies, but also the memory antibodies. And by doing that, we feel like we're able to get a more durable response. And thus far, in the patients that we have transplanted, we haven't seen the type of typical surge in antibody levels that are often expected after transplantation.